The Black Death. In the mid-14th century, a terrifying wave of death swept across Europe. It all began in 1347 when ships from the east docked in Sicilian ports. Hidden among the cargo were rats, and on these rats were fleas carrying a deadly bacterium known as Yersinia pestis. This was the start of the Black Death, a plague so horrifying it would change history forever. Picture a world where a mysterious disease spreads like wildfire, causing gruesome symptoms, sudden high fevers, painful buboes, and dark, splotchy skin. It wasn't long before the disease engulfed cities and countryside alike, turning vibrant communities into ghost towns. Entire families were wiped out overnight. The death toll was staggering. Estimates suggest that between 75 to 200 million people perished, with one-third of Europe's population lost. The plague moved so swiftly that there were often not enough people left to bury the dead. The air was thick with fear and despair as people desperately tried to escape, fleeing cities in a vain attempt to avoid the inevitable. Towns were abandoned, and those who remained could only watch in horror as the Black Death continued its merciless rampage. But how did it end? The plague eventually began to recede around 1351. The reasons are still debated. Some believe it was due to the harsh winter killing fleas. Others think that those who were infected and survived became immune. Whatever the reason, the Black Death left a mark on Europe that would never be forgotten. The Spanish flu. Imagine a world gripped by the chaos of World War I. Amidst the destruction and despair, a new terror emerged. The Spanish flu, a ruthless and invisible enemy, swept across the globe in 1918. This wasn't just any flu. It was a supercharged killer. Unlike typical flu strains, the Spanish flu targeted the young and healthy, causing their immune systems to go haywire and leading to death within a matter of days. Picture this. A simple cough could spiral into a devastating illness, and within hours, a healthy person could be on the brink of death. The virus spread like wildfire, leaping from one city to another, from one continent to the next. In just a year, the Spanish flu claimed between 50 and 100 million lives, far more than the number of people who died in World War I. Hospitals were overwhelmed, and daily life was disrupted as people tried to avoid getting sick. Public events were canceled, and wearing masks became common. By the spring of 1919, its grip loosened, and society slowly began to piece itself back together. But the scars remained. The Spanish flu left a haunting reminder of how a seemingly invisible threat can alter the course of history, demonstrating the immense power of a virus to change the world in the blink of an eye. Smallpox. A ruthless disease with a history as grim as it is extensive began its deadly rampage centuries ago. Its origins are murky, but it's believed to have emerged thousands of years ago, with historical accounts showing its impact on ancient civilizations like the Egyptians and Chinese. The virus spread rapidly through crowded cities and trading routes, leaving devastation in its wake. In the 18th century alone, smallpox claimed about 400,000 lives annually in Europe. Its severity was horrifying. Victims would endure high fevers and a disfiguring rash that covered their bodies. The disease was particularly brutal to indigenous populations in the Americas, who had no immunity to it. The story of smallpox took a dramatic turn in 1796 when Edward Jenner, an English physician, made a groundbreaking discovery. Jenner observed that milkmaids who had contracted cowpox seemed immune to smallpox. He tested this theory by injecting a young boy with cowpox and later exposing him to smallpox, finding that the boy did not contract the disease. This discovery led to the development of the smallpox vaccine, marking the beginning of a global campaign to eradicate the disease. Vaccination efforts gained momentum through the 19th and 20th centuries. Despite a final outbreak in Somalia in 1977, the relentless pursuit of vaccination finally paid off. In 1980, the World Health Organization declared smallpox eradicated. This victory remains one of the greatest achievements in public health history, demonstrating the power of science and collective effort in overcoming a deadly virus. The third cholera pandemic. Imagine the early 1850s, a time when people didn't yet understand how diseases spread. In 1852, a deadly outbreak known as the Third Cholera Pandemic began. Cholera, caused by a germ called Vibrio cholerae, spread through dirty water and food. It was like a hidden enemy, causing severe diarrhea and vomiting. Without treatment, people could die from dehydration within hours. This outbreak started in India and quickly spread to Europe. Cities like London and Paris were hit hard. In London alone, over 10,000 people lost their lives. The streets, once full of life, became eerily quiet as the disease took its toll. The situation seemed hopeless until Dr. John Snow, a brave and curious doctor, stepped in. He noticed that the cases of cholera were concentrated around a specific water pump in London. By mapping the locations of the sickness, he discovered that contaminated water was the cause. His findings led to the pump being shut down, and the number of new cases began to drop. This helped to control the spread of cholera and set the stage for modern public health practices. The third cholera pandemic was a tragic chapter, but it also marked the beginning of important changes in how we prevent and manage disease. Ebola. In 1976, the world was introduced to a deadly virus that would strike fear into many, the Ebola virus. The first outbreak occurred in the Democratic Republic of Congo, then Zaire, near the Ebola River, giving the virus its name. Ebola is notorious for its severity and high mortality rate, causing widespread panic and devastation. Ebola is transmitted through direct contact with the bodily fluids of infected individuals or animals. This can include blood, vomit, feces, or even contaminated surfaces. The virus can also be spread through contact with the bodies of those who have died from the disease. The symptoms of Ebola are horrifying and include sudden onset of fever, severe headaches, muscle pain, weakness, and extreme fatigue. This is followed by gastrointestinal symptoms such as vomiting and diarrhea. In the later stages, Ebola can cause internal and external bleeding, leading to a gruesome and painful death. The outbreaks are often localized, but can be devastating. The 2014 to 2016 outbreak in West Africa was one of the deadliest, with the virus spreading rapidly through Guinea, Liberia, and Sierra Leone. This outbreak alone saw over 28,000 cases and claimed more than 11,000 lives. The impact was catastrophic, overwhelming healthcare systems and causing significant economic and social disruption in the affected countries. Efforts to control Ebola outbreaks involve isolating patients, using protective gear, and improving hygiene practices to prevent the spread. The international community has responded with aid and resources, and experimental treatments and vaccines have been developed to combat the virus. By 2016, the outbreak was declared over, but the fight against Ebola continues as scientists work to understand and control this fearsome virus better. Ebola remains a potent reminder of how quickly a virus can devastate communities and the importance of preparedness and response in controlling such outbreaks. HIV/AIDS, the global epidemic. The story of HIV/AIDS is one of profound impact and resilience. HIV, or human immunodeficiency virus, was first identified in the early 1980s, but the virus is believed to have crossed into humans from primates decades earlier. The virus attacks the immune system, specifically the CD4 cells, making the body increasingly vulnerable to infections and diseases. If left untreated, HIV can lead to AIDS, or acquired immunodeficiency syndrome, which is the final and most severe stage of the infection. The early years of the epidemic were marked by fear and misunderstanding. Initially, AIDS was thought to primarily affect specific groups, including gay men and drug users, which led to stigma and discrimination. However, it soon became clear that HIV could affect anyone, regardless of age, gender, or sexual orientation. The spread of HIV/AIDS has been staggering. As of today, over 38 million people worldwide have been infected with HIV since the beginning of the epidemic. AIDS-related illnesses have claimed the lives of over 36 million people globally. The epidemic has had a particularly severe impact in sub-Saharan Africa, where millions have died and entire communities have been affected. The battle against HIV/AIDS has been a relentless one. In the 1990s, the development of antiretroviral therapy, ART, brought a turning point. ART doesn't cure HIV, but effectively controls the virus, allowing those infected to live longer, healthier lives. This breakthrough has transformed HIV from a fatal diagnosis to a manageable chronic condition. The global response to the epidemic has also included educational campaigns to prevent transmission, needle exchange programs, and efforts to reduce stigma and discrimination. Despite these advances, the fight against HIV/AIDS continues. There is still no cure, and the virus remains a significant global health issue. Continued research, prevention efforts, and access to treatment are crucial in the ongoing battle to end the HIV/AIDS epidemic. The resilience and solidarity of affected communities and healthcare workers around the world continue to drive hope for a future where HIV/AIDS is no longer a global health threat. COVID-19. The story of COVID-19 begins in December 2019 in Wuhan, China, where the first cases of a mysterious pneumonia were reported. The cause was identified as a novel coronavirus, later named SARS-CoV-2. This virus, part of the coronavirus family, spreads through respiratory droplets when an infected person coughs, sneezes, or talks. It can also be transmitted by touching surfaces contaminated with the virus and then touching the face. COVID-19 quickly spread beyond Wuhan, igniting a global pandemic. By March 2020, the World Health Organization declared COVID-19 a pandemic as cases surged worldwide. The virus spread rapidly across countries and continents due to international travel and close human contact, overwhelming healthcare systems. The impact has been staggering. As of now, over 770 million cases have been reported globally, and more than 6.9 million people have died due to the virus. The pandemic has led to significant disruptions in daily life, with lockdowns, travel restrictions, and social distancing measures becoming the norm. Governments and scientists race to combat the virus, developing and distributing vaccines at unprecedented speed. Vaccines like Pfizer-BioNTech, Moderna, and AstraZeneca have been pivotal in reducing severe illness and deaths. Additionally, public health measures such as mask wearing, hand hygiene, and social distancing have played crucial roles in controlling the spread. Despite these efforts, the virus has continued to evolve, with new variants emerging that can spread more easily or evade immunity to some extent. The ongoing battle against COVID-19 involves continuous monitoring, updating vaccines, and adapting public health strategies to new challenges. The pandemic has highlighted the importance of global cooperation and the resilience of healthcare workers and communities worldwide. As we move forward, the lessons learned from COVID-19 will shape future responses to pandemics and emphasize the need for preparedness and solidarity in global health crises.